We'll move on next to the HPA axis and stress response. Acute administration of cocaine results in increased plasma ACTH in rats and increased cortisol in humans. And chronic exposure to cocaine results in decreases in the CRH receptor binding. During self-administration, we see that the HPA axis appears to play a role in learning and self-administration. Increases in plasma corticosterone, increased sensitivity to reinforcing effects, and we see that adrenalectomized rats do not learn to self-administer cocaine. So this would indicate that this plays a very significant role in the acute reinforcing effects of cocaine. Similarly, in animals that have been adrenalectomized, we do not see a reinstatement of drug-seeking behavior following a foot shock. So this is considered to be an environmental stress. However, removal of the adrenal gland appears to have no effect on drug priming reinstatement. So those animals who were primed with cocaine did reinstate drug-seeking behaviors. This further illustrates the role of HPA in reinstatement following foot shock. This is a substance that reduces the synthesis of adrenocorticosteroids, and the CP here is a agonist of the CRH receptor binding. So they both have an effect on drug reinstatement following a foot shock. So again, interesting that that the HPA axis appears to have a role in some types of relapse triggers, but it's not an across-the-board effect. We do have some human research implicating the role of the HPA axis in stimulant use. In humans, stress-induced cocaine craving, so individuals who left treatment and demonstrated, as they left treatment, demonstrated cocaine cravings associated with stress. That was associated with shorter time to relapse. That cocaine craving was associated with stronger cortisol responses to stress. And so here are a couple graphs. These are cortisol and corticotrophin responses to stress associated with amount of drug use. And so you'll see that the greater the response of both cortisol and corticotrophin to stress, the greater response is associated with greater substance abuse following treatment. And similarly, when they were dichotomized as either high responders or low responders to stress, you see a greater increase over time, a quicker relapse in those high responding individuals. The HPA axis and the effect of exercise on the HPA axis, this is probably an area where there is a bit of conflicting information, though there is at least some evidence to suggest that exercise can affect HPA axis function in at least certain segments of the population. Exercise does increase cortisol excretion. Chronic exercise training in humans is associated with a reduced cortisol level. And physical fitness has been found to be associated with reduced cortisol response to psychological stress.